My name is Vladimir Poznyak. I'm Coordinator of Management of Substance Abuse at the Department of Mental Health and Substance Abuse of the World Health Organization, based in Geneva, Switzerland. Substance use is one of the major preventable risk factors for poor health in populations. And just to give a few examples, according to WHO estimates, just alcohol consumption causes around 3 million deaths every year due to different causes. The drug use, including such psychoactive drugs as opium, like cannabis, like stimulants, cause approximately 500,000 deaths every year. And we know now that in some jurisdictions like the US, Canada, to some extent Australia, there are significant crises with opioid mortality. So when a lot of people, particularly middle-aged, are dying from opioid overdose. So the impact of substance use is enormous. And what is important is that this impact is largely preventable. Several years ago, the World Health Organization started some technical activities related to excessive use of internet, smartphones, other electronic devices, largely in response to the concerns expressed by our collaborators, by public health advocates, by researchers who are active in public health. And we started these activities of looking at the scope of public health implications of use of these devices. And later on, we started to look at these conditions from the perspective of the need to include or not to include them in the next reiteration of the International Classification of Diseases. We found that there is sufficient evidence to consider that not only gambling disorder, but also gaming disorder, which is basically digital gaming disorder, we have sufficient evidence to have it in the classification to ensure that health professionals can recognize these conditions in their clients, in their patients, that more research is done, more discussions and collaboration at the international level is taking place using similar understanding of the concept. And of course, we also hope that inclusion of a gaming disorder in the classification of diseases will allow better monitoring of the trends with these conditions in populations. At the same time, it's technical activities. And in the World Health Organization, in our governing bodies like World Health Assembly, we didn't have yet these discussions. Still we have quite significant gaps in our knowledge about the actual impact of these conditions on population's health. One of the priorities that was clearly identified in the technical meetings that we had during the last 4 years was the need to develop the international instruments, screening instruments, to assess the risks associated with gaming and gambling. And these instruments may allow health professionals to assess the level of risk and to intervene, and by this to prevent further development of these conditions and to prevent disorders, and also to reduce the overall impact of these behaviors on well-being and happiness. The next priority is definitely what we need is much better documentation of the impact of gaming and gambling on population health in terms of premature mortality, in terms of disability, in terms of the impact of these conditions on other conditions of higher priority, such as depression, such as suicidal behavior, such as substance use disorders. And this is still to be done. Another priority is related to a very poor evidence that we have around the scope of these conditions, about their, again, influence, impact on health of populations in less resourced countries. Almost all studies in this area are limited to a few countries in the developed world. And at the same time, the current trends with digital media, with availability on internet, casinos, gaming, with monetization, significant elements of monetization like loot boxes, like gacha, make them easily available in all parts of the world. And we still need to understand better and to assess what would be the impact of these conditions on health in low and middle income countries. Another priority is definitely to look at the, again, health consequences and public health implications of some new phenomena which are taking place right now. I mean, the convergence between gaming and gambling, as well as such phenomena as e-sport, which is very rapidly developing, and to what extent it will influence the rates or prevalence of disorders due to addictive behaviors, how to balance the normal enjoyment from entertainment by playing games, by playing some gambling, lotteries, and many people, most people are in their lifetimes are involved in that, with the potential harms and how to prevent these harms. And another priority which is extremely important for the governments to design their prevention policies is the evaluation of effectiveness of different prevention policies. And finally, we need to know much more about the effectiveness of different treatment approaches for these conditions. One of the messages is that our knowledge about the health impact and health consequences of these conditions is very uneven, with a very significant bias towards high-income countries. And currently, digital technologies and gambling and gaming platforms products are becoming widely available in the world and easily accessible. We need to know much more about the impact of these products on the health of people in less resourced countries. We need to pay particular attention to recent developments in this area, like e-sport, like convergence of gaming and gambling platforms. The technological developments are so quick, so rapid nowadays, and the concern is that public health measures will be always delayed, will be always not adequate to the new realities that we face in the world. Finally, I think we need really a massive investment into the research in this area to, first of all, to document better the impact on our lives, on our health. But second is to inform prevention and treatment policies and interventions.